Have the pleasure of having Sue Ward coming back for a second session to talk about micronutrients. Please welcome Sue Ward.
Good morning. So how many, and good morning to those of you watching online, how many of you got on the scale this morning after you pooped? just wondering. So, you know, at Sonaviv, in the morning, we start our day with a meditation. And there's one thing that we do at Sonaviv called laughter yoga. How many people have done that? It's really fun. It's a great way to start the day. And I just wanted to mention that when we have a new therapy at Sonaviv, when we learned laughter yoga, we practice on the employees first before we do anything with patients. So I wanted to share with you our practice session for laughter yoga. Let's see. So, there it is. Can we get that video up? And see if you could not laugh. I hear it. That's funny, isn't it? And you know, with laughter yoga, there's no jokes. You just laugh, and you laugh, and then you have to stop laughing, but then nobody can actually stop laughing. Do I need to do something? Like, laugh? Is it not working? Oh, hang on a sec. I advanced the slide. There it is. Do I have to start it? Ho, ho, ho! There it is. You have the idea. There we go.
Laugh and breathe.
That's my husband. It becomes much more difficult when you're trying to stop laughing and then you can't. So what a great way to start the day, right? Rather than watching the news. So that's how we start our day, and I thought I'd give you a little sample of that. We're going to talk today about the products, and you've got some great nutritionals at your fingertips, and I want to find out why the clicker isn't working. Oh, there we go. Okay. So, we're going to talk about the nutritionals. So, we know we have the best products, right? And everybody says that they have the best. Doesn't every company say we have the best products? But USANA can actually back it up, which I love. So before we get into that, though, we want to talk about intelligence. You've heard that at convention, right? Does this confuse anybody? It can be a little overwhelming, and we're going to go a little bit into what is intelligence. But about 2015 February, so we're talking about 2 years ago, we got a call from USANA Research and Development Team, and they invited me and a few of our other doctors to Salt Lake City, and they said, this is what we're doing with the essentials. So we had inside information and about intelligence. At the time, it didn't have a name. They didn't know what we're going to call it, but we were so excited about this. We said, this is wonderful. No other company's doing this. So we got really excited about it because we were able to test the product at Sonaviv in March of 2015. And I'm going to share some of that with you. But before I do, let's talk about what is intelligence. So this is a technology, and this is where we take plant phytonutrients or plant molecules, and those molecules are going to target specific pathways in your body to have your cells communicate more efficiently with one another. So remember we said yesterday, when you begin to eat, your brain sends a message to your saliva glands and you begin drooling? So that's a similar thing. So we're going to take the plant nutrients and let the plant nutrients talk to our body and talk to our cells. So we have intelligence. And you know, some of the USANA products like Hepasil, we talked about that yesterday, and Precosa, they've already had intelligence technology, but we just didn't call it that. So those formulas didn't really change. We've been using it right along. So we talked yesterday about Hepasil, and Hepasil is a good example of cell signaling, where the molecules milk thistle and alpha-lipoic acid are talking to your cells to get the liver to produce what? Glutathione and our internal antioxidants. So this is really great, and I wanted to put this up here. The intelligence phytonutrients, let's talk about that. So alpha-lipoic acid, what is that in, you guys? What product? It's in coquinone, it's in Hepasil. And there's something I forgot to mention yesterday. Alpha-lipoic acid is wonderful for diabetics because alpha-lipoic acid helps convert glucose to energy. So this is a wonderful cell signaling nutrient. We have curcumin in what? Precosa. Yeah. We have green tea extract. You know, if you were going to go out to the health food store and buy these nutrients, you would have 15 bottles of different nutrients. But what I love that USANA did is they took the best of the cell signaling nutrients and they put them all in the multivitamin. No other company has done that. This is really, really good. Now, in some of the markets, you have broccoli seed extract, rhodiola. Where's rhodiola found? Do you know? Rev3. Do you know what rhodiola does? It like calms you down. So even though your Rev3 has caffeine, which gives you energy, it's not like a nervous energy because the rhodiola in there is more of a calming energy, so you don't get shaky with the Rev3. So I love that nutrient. Grapeseed extract is a cell signaling nutrient. Ginseng. Some of these nutrients are actually in some of the other intelligence formulas in other markets. So, okay, so we're going to get a little tiny bit technical, but not too much. So I don't want you to get confused. There's not going to be a quiz. But I wanted to just, as an example, point out 2 cell signaling pathways. So that just means communication network. And so there's a pathway called NRF2. And when that pathway is activated in our body, it turns on our body's ability to produce our own internal antioxidants at the levels that we need on a given day. So glutathione, SOD, and catalase, those are internal antioxidants that are like 100 times more powerful than a molecule of vitamin C. So isn't this good news that your body can produce as much of a substance as it needs to get the job done? And you know what? Maybe one day you need more. So who had a cocktail last night? Oh, come on, you guys. Who had a cocktail last night? Okay, so today you're going to take your Hepasil, and your body may produce a little bit more glutathione to kind of clear that out of your liver. Okay, so that's really cool. So NF-kappa B, or NF-kB, is a pathway that is responsible for inflammation. So it can turn it on when we need it, but then we don't always want it on. Sometimes we want it off, so we don't have inflammation all over the place. So cell signaling is really unique, and it's just a way that our body communicates, the way our cells communicate. So this is going to build a lot of renewal mechanisms so your cells can renew and regenerate. So I am so excited that USANA did this, because 2 years ago, I couldn't even contain my excitement. I was sworn to secrecy. I couldn't tell anybody. So we'd have associates come, and I couldn't say anything. I had a sign in blood that I wouldn't say anything for 2 years, and I was so excited. So what we did at Sanoviv, we got the Cell Essentials in March of 2015, and we didn't even know what was in them. They didn't tell us what the changes were going to be. But they said, Sue, find 20 people, and let's do blood work, and let's test them, and let's see what the Cell Essentials do. Wow, that was another powerful research study that we did. I couldn't tell anybody what we were doing. I said, just take these for 1 month, and we're going to test you again. And we saw quite a few interesting changes, and one change that we saw that really blew me away. Have you guys heard of homocysteine? Homocysteine. It's a marker for heart disease, and if your homocysteine is high, you could be at risk. What we saw in 100% of our subjects, homocysteine went down. In everybody. Even those with normal homocysteine, it went down just a little bit more. And we thought that was pretty significant. So there were certain nutrients in the Cell Essentials that are doing this. One of them is choline, which helps with methylation or processing of all of our nutrients. So that was significant. We also saw an increase in vitamin D levels, and it wasn't a significant, huge increase. It was just enough where we said, oh, the levels are going up. And they didn't even add that much more. I think it was at 1,800 and it went to 2,000. But we saw that. And the biggest change we saw is that everybody seemed to have a little more energy. And that was interesting. And I experienced that, but not during the study. It was after the study when I didn't have them anymore, and I started feeling a little tired. And I thought, can I get those back? And I had to wait a full another year and a half before we had these back. So the Cell Essentials is the foundation for everyone. And this is a powerful multivitamin, you guys. I mean, antioxidants, cofactors, a whole intelligence complex in there. You know, most people do so well with just this one product. And I would sometimes get people saying, well, you know, I can't afford it, so what can I do? Should I go get a brand name, 1 per day tablet? And I said, you know, if you took 1 tablet of each, it would be better than anything that's out there right now. So start wherever you can. Even a half a dose of Cell Essentials is super powerful. I love that they put preformed vitamin A in the product, because in some people, they don't convert beta carotene to vitamin A very well. And so this really solves that problem. 1,000 milligrams of vitamin C. There are no other multivitamins that have that much. This is great. K1 and K2. K2 is really, really important for directing calcium and vitamin D to the correct places in your body. We have N-acetylcysteine. Do you guys know what that is? It's in Hepacil. N-acetylcysteine is the cell signaling nutrient that tells your liver to produce glutathione, antioxidant, right? When people have you guys heard of like overdosing on acetaminophen or Tylenol type of product? That is a depletion of your glutathione, and I once had an EMT come to me, and he says, we give that intravenously in the emergency room to people who overdose on acetaminophen. And I went, N-acetylcysteine, because it's so powerful in creating the antioxidants we need in our body. And then we have, my favorite is a 1-to-1 ratio of calcium and magnesium. Perfect. Magnesium is so needed in our population. We see more magnesium deficiency at Sonovive than we do calcium deficiency. Magnesium is also important for the bones. It's important to keep your blood pressure low. It's important if you're not sleeping well. Does anyone ever crave dark chocolate? Yep. You might be magnesium deficient because there's magnesium in dark chocolate. That's not an excuse, just saying. So let's talk about Precosa. Precosa is really powerful. Again, we have glucosamine for joints and cartilage. And glucosamine actually stimulates the production of hyaluronic acid in your body, which is for shock-absorbing cartilage stuff. So this is great for athletes, for arthritis, for any kind of joint stiffness. But the real power in this product is the curcumin, isn't it? USANA uses Meriva curcumin, which is much more bioavailable than a lot of other brands out there. And I gotta tell you, do you know what we do with curcumin at Sonovive? We actually do it intravenously, and we call it liquid gold. It's an amazing treatment. We use it in our cancer program. We use it in other programs it's anti-inflammatory. So how many of you have thought about taking Precosa for a headache? Why not? Try it. It's anti-inflammatory. So instead of taking a non-steroidal anti-inflammatory drug, try Precosa. Anti-inflammatory. How many of you have thought about Precosa for skin and hair and nails? It's cartilage, it's tissue building in our body. So I love Precosa, and when my dog was experiencing arthritis, I gave her this, and she would actually eat it out of my hand. Like, I was crushing it up, and then one day I dropped a pill and she ate it, and I said, I don't have to crush these anymore. But without the Precosa, she was not able to walk. Her arthritis was so bad. I couldn't believe the power. I ran out and I said, when is my auto ship coming? I need this. The poor dog. So it's powerful, you guys. So think about it for other things. Think about it for a headache. Think about it for menstrual cramps, things like that. Any kind of inflammation in your body, Precosa. All right, now we're going to have a lesson on how to pronounce this next. Okay. Proglucamune. So we have pro-gluca, because there's beta-glucans, and mune for immune support. So I have a challenge for you, and I think this will be really fun. I want you to film each other saying proglucamune 5 times really fast, and then send those videos up to USANA. This is fun. So proglucamune. This is a great product. I was so excited about this for supporting your immune system. So immune cells are generally passive. Do you know what that means? I'm going to show you. Okay, everybody stand up. And we're just going to cross our arms. And we're going to be like, a little bit passive, hang out. So you're all immune cells right now. And you're just passive. And you're waiting for a challenge to come into your body. Maybe a cold virus. And then you see the cold virus coming into the body and you go, oh, I gotta get it. I gotta get it. That's a passive immune cell. It will work, but it's kind of hanging out. Now, if we prime that immune cell with some beta glucans, you guys are like this. You're like, okay, come get me. Come get me, cold virus. And now your immune cells are ready, just a little bit more alert, ready to take on a challenge a little bit more efficiently. That's what cell priming is, immune cell priming. Okay, you can sit down. Immune cells, you can sit down. And at home, you can sit down now. Thank you at home for participating with us. So we want to do this to just make sure that our immune systems can respond. This is the type of supplement that is probably not going to be really helpful when you already have a cold. It's something that you need to take ahead of time to just strengthen the immune cells. I love that it contains zinc, and zinc is wonderful for your immune system. The beta-glucans from mushrooms, reishi, shiitake, and yeast. Okay, the big question that I get is, does this feed yeast in your body if you have a yeast overgrowth? What do you guys think? It does not feed yeast. So you don't have to be afraid of that. It's a different type of yeast that's actually a very healthy bacteria that our body can use. I think it's great for symptoms of any type of immune challenge, any type of, just daily stress. Does anybody have stress? When you're building your business, right? It's really helpful. So I like this one. And I think this one is so powerful that I think you could even do one a day. I think one a day is fine, it's very powerful. I had some great mushrooms last night at the Chinese restaurant, and I was thinking that I was priming my immune cells with the food. So I love ProGlucamune. Practice saying it, do it 5 times really fast, and then say it backwards. Okay, we need to talk about coquinone or CoQ10. CoQ10 is found in every cell in our body. It's powerful. Our bodies produce it. We produce it. But guess what happens if your doctor puts you on a cholesterol medication? It stops your body's production of CoQ10, which is our heart nutrient, which is our energy nutrient. So sometimes when we're just feeling a lack of energy, that's actually a CoQ10 deficiency. So how much do you need if you're on a statin drug, if you're on Lipitor or Crestor or something like that? A lot of people ask that question. I think 100 milligrams is a really good dose for that, and you really need to be on that if you're on a statin drug. If not, a lot of the side effects of the statin drugs, like muscle pain and weakness and maybe even memory problems, that actually stems from a coenzyme Q10 deficiency in your body. So this is a really important one. It's a powerful antioxidant, and there has been research done with Parkinson's disease and coenzyme Q10. Finding they gave Parkinson's in the study, they gave them about 1,200 milligrams a day for 18 months and found no toxicity. So this is a non-toxic nutrient. It's fantastic. I like to do the 100 milligrams, so I do it in my health pack. Does anybody else do that? And you may want to make sure you put it in your AM pack because it can give you energy. So if you're not sleeping well, you may not want to take the coenzyme Q10 at night. So this is a great nutrient. Also, it's great for athletes for recovery. So if you're doing a lot of running or training for marathons or swimming or any kind of competition, this is really great for muscle recovery. Okay, we're going to go to everybody's favorite. Everybody loves proflavanol. I remember, everybody, when I asked them their favorite nutrient, they're like, proflavanol. It does so much, you guys. Vitamin C combined with grapeseed extract is really powerful. So let's talk about vitamin C first, and I'm going to give you some really good tips. So vitamin C actually, it helps us detox. So, sometimes when people are taking even the Cell Essentials or the Proflavanol, they'll notice detox reactions. Maybe some people have their skin breaks out. They get a little rash. Sometimes that's detox happening. And it promotes good blood flow. It's essential for our heart. It helps us to get rid of heavy metals. There's a lot of nitrites in like deli meats and hot dogs and bacon and things like that. Vitamin C helps prevent those from turning into carcinogenic substances in our stomach. This is really powerful. Love vitamin C. Vitamin C is Dr. Wentz's favorite nutrient, of course. And then we have grapeseed extract. It's actually a cell signaling nutrient also, but what I love about it, it's anti-inflammatory, it's antibacterial, it's antiviral, and antihistamine. What is that good for? Allergies, correct. And what I love is when you combine grapeseed extract with quercetin, which is in the Cell Essentials, it's an even more powerful antihistamine. So I know that Proflavanol works when people have seasonal allergies, or if you have allergies to pet dander, dogs and cats, it works great, but now even better with the Cell Essentials. It also decreases pain. So think about Proflavanol also for things like minor joint pain and aches and things like that. This is a wonderful product. And I want to talk a little bit about vitamin C and upper limits, because some of you guys were asking questions about how much should I take of this and can I overdo it. With Proflavanol, there's one main side effect for vitamin C. Does anyone know what that is? Diarrhea. That's it. So if you're constipated, this is good news. You can take a lot of vitamin C, and vitamin C has a bowel tolerance. And after a certain amount, you're just going to get diarrhea and it won't be absorbed. Also, vitamin C is better absorbed in small doses throughout the day. So sometimes I actually pull the Vision X or the Proflavanol out of my health pack and take it in the middle of the day, and I split it up. You can do that as well. A lot of the USANA nutritionals have vitamin C in it. Vitamin C is an important cofactor for a lot of reactions in our body. So we just love Proflavanol. What about Booster C? This is fun. I love this product. I have it with me on this trip because this is what you want to take when you're going to fly on an airplane, right? And it's so simple. You're just putting it in your water bottle, and you're getting 600 milligrams of vitamin C and 10 milligrams of zinc. Zinc is also very, very good for your immune system. So again, but one thing I love that USANA did, they assume that people are going to take more than one of the optimizers, and even if you take them all, you're not going to be overdoing it because the amounts are precisely measured for the proper doses. So I love Booster C. I think it tastes great. Isn't it great? So black elderberry extract has been really well studied for upper respiratory tract infections and immune system support. Fantastic. And we all know the benefits of echinacea too. Same thing. Love this Booster C. Okay, now we're going to talk about vitamin D. So how many here are from Canada? Way up there. Canada, welcome, Canada. Well, you guys are really deficient in vitamin D up there. Unless you're eating liver and onions once a week. Remember, that's how we used to get our vitamin D, but nobody's eating liver anymore. And if you eat liver, congratulations, you might not need as much vitamin D. But vitamin D is one of the most important nutrients for hormones, for immune system. It's a powerful anti-cancer substance, okay? We should know what our vitamin D level is in the summer and in the winter because it's going to change depending on your sun exposure, depending on your diet. Vitamin D, there are two really good websites I like to refer people to, vitamindcouncil.org and Grassroots Health. Now, you can go to either of these websites, and I have an idea for you guys. We're always looking for ways to build our business, so why not have a vitamin D party? And what you do is you order vitamin D self-test kits from one of these places. Okay, so it's about $40 or $50. And you prick your finger and you drop a little piece of blood, a little drop of blood on a card, let it dry, mail it into the lab, and in about 2 weeks they mail it back and they tell you what your vitamin D level is. And we want to be between 50 and 80 nanograms per milliliter. If you have a history of cancer, you want to be closer to the higher side, more like 80. So once you know what that is, your level is, you reconvene your party, get everybody to come back and share what's their vitamin D level. If you go to grassrootshealth.org, on their website, they have a calculator, and you type in your body weight and your vitamin D level that you just received. And if it's, let's say your vitamin D level's 30, but you want it to be 50, you punch that into the calculator, and it tells you exactly how much you should take per day in international units. Isn't that great? If you want it to be 50, you take this much. If you want it to be 80, you take this much. And it really, with the research is showing that most people do really well with anywhere from 2,000 to 5,000 units per day. So the Canada vitamin D is 1,000 per pill, the US is 2,000, and it may be different in other markets. So calculate it based on how many international units, and you want, the calculator will tell you exactly how much to take. And then what you do with your vitamin D party, your customers, you can reconvene in the summer. If you did this in the winter, reconvene in the summer and test it again and see how you need to adjust that in the summer. And once you do this twice, once in the winter, once in the summer, you're going to know exactly how much you should take. Some people need a little more in the winter and some people don't. Some people eat liver. So is this a good idea, you guys? So just do a vitamin D party and learn about vitamin D, and you can print out resources from the websites on, the benefits and how it's benefit. What else is vitamin D great for? Did anybody hear of depression? How many psychiatrists do you think are testing their patients' vitamin D levels? Probably not many, but this is really important. So vitamin D needs to be, at least 50. Sometimes at Sonovive, when we test vitamin D in every patient, and what I've seen is severe deficiency, especially in cancer. And the lowest that I've seen, and it was a cancer patient, was 8. 8. And we thought, whoa, that's pretty low. And so there was a lot of dysfunction in the body because it was very, very low. And, it takes a while for your vitamin D level to go up. It's going to take about 3 to 4 months, so don't expect it to go up too quickly. But super important, this was, Dr. Wentz was passionate about this nutrient, and he said we've got to get more in the Cell Essentials. The Cell Essentials gives you 2,000. That's incredible. There's no other multivitamin on the market that has that much. This is fantastic. Okay, let's go to another one, Biomega. Biomega. It's really important to maintain a balance of all of your fatty acids. So Biomega is primarily what, you guys? Omega-3, right? We also have omega-6, and I want to say that omega-6 is not bad. It's essential, and we need it. Most people are deficient in omega-3s, and those omega-3s are going to be found in foods like salmon, in walnuts, in flax seeds, in chia seeds. But if you're not eating that, you probably need to supplement with Biomega. So one of the questions you can ask your customers is a little bit about diet. You don't need to be a nutritionist. Do you eat salmon? Do you eat chia seed? Do you eat flax? And you can get an idea that if they don't eat any of this, they probably need at least 1 Biomega, but if not 2 per day. So, and for people that don't like to swallow pills, I love the Biomega Junior. I remember one year at convention when they released this, you got to go fishing. Do you remember that? They had a little booth where you go fishing and you catch a Biomega Junior. So I think Biomega Junior is excellent for adults who don't want to swallow too many pills, and it tastes fine. But I want to point out something that I think is really important. Can you overdo Biomega? Yes, you can. So this might be news to some of you, but At Sonavive, when we get somebody, and it's usually a USANA associate that's taken 8 Biomega a day for 2 years, and we do a fatty acid blood test. So I hope you guys can see this. And it says omega-3, and you can see it's way up here. Look what happened to omega-6. It's not here. So it competes for a pathway, and an overabundance of omega-3 can cause an omega-6 deficiency. GLA, or gamma-linolenic acid, is really important for inflammation. It's anti-inflammatory. So what we see is not only did it create a deficiency in omega-6, but if we look at this ratio down here, this is actually an indicator of a zinc deficiency. So we don't want to overdo Biomega. Most of the research shows that 2 per day is going to do the job. And if you do take a little bit more for something, it should be very short term. It should definitely be short term. So we call this omega-3 dominance. And oh my gosh, that should say omega-3, not omega-E. So, and what are the symptoms of an omega-3 dominance? Well, you are a little bit harder to overcome infections, and your inflammation doesn't go down. And it can actually oxidize your LDL cholesterol. So we should be very careful to not overdo this one. Just remember, all nutrients need to be balanced. So how can you get more omega-6 if you think you have too much omega-3? You eat a lot of sunflower seeds. And sunflower seeds are very rich in omega-6. Omega-6 is also an essential nutrient that we need to get. Our bodies can't make it. So is this news to you guys? Yes. I know, you're blown away, right? I had to say this because we get a lot of USANA associates. We test their blood, and then we see this pattern all the time. And I say, we're overdoing the omega-3. USANA has done amazing research on omega-3. When they say the dose is 2 a day, 2 a day will work. 2 a day will work just great. So keep that in mind. And next time you come to Sonavive, we can test your blood for your fatty acids. Okay, Vision X. I love Vision X. I noticed that when I regularly take Vision X, I can go down in the pharmacy reading glasses. I can go down a little bit. Vision X really, really works to support long-term eye health. That's really important. And the nutrients in Vision X, lutein and zeaxanthin, have been so well studied. There have been huge, huge studies on how this can help with age-related macular degeneration. And I think it even helps with a few other eye conditions. It's not supposed to, but it does, because I know that even with glaucoma, you can do that eye pressure test, and your score can actually improve on this product. So here's a tip, though. If you're taking Vision X and you don't notice any changes, try taking Hepasil in addition to Vision X. Because when you're toxic, toxicity will manifest in your eyesight, and you won't be able to see as clearly. And we see this all the time at Sonavive, so we get our patients down there for 5 days, and by the time they go home, after they're drinking all this green juice and flooding their body with nutrients and detoxing, their eyes are clearer when they go home, and we see this all the time. So think about that. Sometimes it's toxicity. And what's really important about the eyes, think about the blood vessels in the eyes. They're very tiny, aren't they? We need to move. We need to exercise, because if you improve your circulation, that's going to improve circulation also to your eyes. I also like the idea of doing yoga, because you're upside down, you're in different poses. You could do laughter yoga just laying on the floor, right? And you need more circulation to your eyes. This is an area the circulation is really small. Capillaries are very small. So love this product. I love the fact that we can do a My Health Pack, and I don't know about you guys, but I love My Health Pack. This is the greatest thing. I can't even remember when USANA started this, but do you know last year, now I'm just starting to see practitioner brand companies do this. USANA did it way before everybody else. So I love the My Health Pack. Is this not the best thing in the world? So I get to go here I said I'm going away for 3 days, and I can just rip off 6 packets, and I'm set. Oh my gosh, that's so easy, and I love this. So think about using My Health Pack or Health Pack 100, and what I like about it is we now have something called MagnaCal D, which you can only get in the My Health Pack or the Health Pack 100, that has a perfect 1-to-1 ratio of calcium and magnesium. This is awesome. This is so incredible. Do you guys use the My Health Pack? And I know that in Canada you can get it too, I believe. It's awesome. And sometimes, what I like about My Health Pack is you can customize it. So let's say you have this vitamin D party and you need more vitamin D in the winter. You can change it in the winter and in the summer. And I really don't care if it's slightly more expensive. It's going to be expensive if I don't take this product, So I think this helps people comply much better. I think it's environment friendly. You just have a little piece of plastic you can recycle. So I would say consider doing a My Health Pack, even if you do it periodically, or consider doing a USANA Health Pack. Yesterday someone asked about the USANA Health Pack. When you're starting out new customers, let's say somebody who's never taken vitamins before, it's okay to start them out with the Health Pack. Have them do the AM pack in the morning, and the next day do the PM pack, and have them do that for a couple weeks. Because what can happen is there's such a powerful dose of vitamins in there, especially vitamin C. If they start out with the whole pack, you know what might happen? They might get diarrhea, and they might get scared. And we don't want to scare them away. And I also want to say, remember, vitamin C helps us detox. So think about this. The next time you have to go to the dentist, I know this is random, but don't take your vitamins before you go, because vitamin C can detox the anesthesia, and you might not get numb. And they're injecting you with more and more anesthesia and you're not getting numb because you've got so much good vitamin C, you're detoxing it. So take the vitamin C after the dentist and take it with a Hepacil, and the numbness will go away much more quicker. Isn't that a good tip? So there's another one for you. I found that out the hard way. What? You're not giving me more needles and more needles. So, okay. So how do I know if my supplements are working? Do you ever get this question? I used to have people say, okay, you guys, just write down on a piece of paper all your little things. I'm not sleeping well, low energy, whatever your little symptoms are. Write it down and put it away for 6 months. Take the products for 6 months, and then take out that piece of paper and see what went away. You won't remember that you had this little annoying thing that actually went away. So it takes a while. So I would say if you can get people to commit to at least 3 or 4 months, you're going to see some good changes. Energy, sometimes we see changes faster. If you're looking to really, get your liver in a healthier state, it's not going to happen in a month. It's going to take a while. To get into your organs, you need about 6 months to really affect the organ systems. It might take longer if you're trying to build bone density. So if you have somebody take a bone density test, have them do the product for a full year and then take another bone density test at the end of that year. It takes a while. So I like doing this, and I don't know, have any of you done this where you just write down all these little things and put the paper away and then take it out again? This is a good way to show your customers and potential new associates that it does work, okay? So, I hope I've given you some more tips and good knowledge, right? I'm going to be here all day for questions, so if you guys have questions, I'm sure I probably forgot to say something that I wanted to tell you, but I'm happy to be here for you and answer questions. Thank you again. This is a carving out of a watermelon from, again, our head chef, Ismail, who's a food artist. So again, if you'd like to learn more about Sound of Eve, what we do down there, just visit our booth back there. And again, I'm happy to answer any questions for you guys. So please write them down. And again, thank you so much for your time. I appreciate it.